You know there's a way for nurses to start a business, but there's so many moving pieces. Cut through the crap. It's time to go right to the source and get real about what's working in business and marketing for nurses with your host, the founder of NursePreneurs, Katie Harris.
Welcome to the NursePreneur podcast.
Thanks for having me.
So, Chris, you are the co-founder and CNO of IntelyCare. Tell us about IntelyCare, what it is, and how you got started in this.
Sure. So IntelyCare is a workforce management / on-demand nursing platform. We concentrate on filling shifts in a per diem sense for long-term care facilities, particularly. That's our niche. So I started it back about 3.5 years ago, and I was working in a long-term acute care hospital. And we were being mandated pretty frequently. I was actually a union rep, and I did some nursing informatics too. So I was working in the tech side. I was trying to implement, EMARs, as well as trying to bring in other platforms to try to fight for the nurses. And there was really no good solutions out there. So I started working. I was working in the IT side as well, and the director of IT was doing some startups. He was doing some sensor stuff, and I was doing some home care stuff. So we actually decided that time, let's jump together, and we were actually going to try to Uberize home care. We thought it was kind of the easy in to get going, much less hard than actually working with some of the business clients, getting some small clients and working our way up. So we started dabbling down the home care side, and then we stumbled back in the long-term care side and realized that was really the client that needed this platform. Long-term care is a field where there's smaller facilities, not as much resources, and when somebody calls out, there's really just nobody to replace them. So we transitioned over to that after about 6 months, and ever since then we've been thriving. As far as there's need for last minute coverage, in most all facilities that we've actually come encountered with so far.
So how does your system work? Like, how does it get that on-demand coverage?
Sure. We developed it ourselves. So, it was from the ground up. When we first developed it, it looked kind of fake. It didn't have a great functionality. It didn't have a great look to it. But we've been, adding additions. We were doing weekly updates for about 2 years, on adding different types of GPS functionalities, different type of messaging systems, engagement. So it's similar to an Uber-ish model of an app. We have the mobile app, and we have the client-side functionality where they have their schedule. Then we have our operations side, which is the internal credentialing, recruiting, and kind of running the operations staffing side of the business. So it's 3 sides, and every week we're making new updates based on feedback from both clients and nurses to make it better.
Okay, so let's say I'm a manager of a post-acute health system, and somebody calls out.
Mm-hmm.
What do I do? I have your app, and presumably I have an account with you, and I can another nurse will magically appear.
Yeah, it's magic. So we have the mobile app for the clients. That's actually something that they recently wanted, because a lot of skilled nursing facility and smaller facilities, the schedulers actually work as multiple hats as well. They're walking around doing different type of supplies. So they jump on our app, they jump on our platform, put a request in. And for those last minute requests, what we usually do is we actually have a premium charge so we can pay nurses more, which is great. So there's kind of the nurse that really likes to just pick up last minute shifts, and also the other nurses that pick up 4 or 5 days ahead.
Mm-hmm.
So for those facilities that are requesting last minute, we're surging the price, and we're also working with clients to agree upon those prices to get a higher fill rate. So it's notifications, it's in-app notification, text message notification, also finding out when nurses want to work, so they subscribe to different facilities of when shifts come in. A lot of different engagement tactics to get nurses to pick up shifts, and kind of that sweet match.
Right. And what kind of engagement tactics do you have?
Yeah. So right now we use gamification in our app, which is a level system. It allows us to allows nurses to get additional bonuses and early notifications for the shifts they want. So it's kind of a tiered system, which is really tracked around reliability. That's kind of a big factor in our business. Our business is really, work for IntelyCare for a part-time role, but also have your other role that's usually your number one. And, sometimes telling a nurse that, hey, this is your number two, they take it a little bit less serious. So we've built positive reinforcement that tracks if you work consecutively and you don't call out of the shifts you take. You'll move up from gold to silver to gold to platinum, and at platinum you're getting different bonuses for completing shifts without calling out, with being on time and getting high star ratings. So I think that's really our engagement right now, but we continue to do promotions and different types of bonuses and rewards within the platform.
Yeah, that sounds like a great model for staff nurses where it is their primary job. I mean, that would be amazing.
Yeah.
So what came first here? I mean, do you have to go out and recruit nurses first? Do you go out and get clients first, and just kind of bringing them together? It seems like a lot of work.
Yeah, that's I guess they call it the chicken and the egg around here.
Yeah.
So I mean, that's really the key to staffing, being as successful as a staffing business. We use technology to make it operationally more efficient for both sides. But as we go into new markets, it's really kind of recruiting ahead of time, knowing that you're going to have clients in that area, because nurses will become disengaged if you don't have shifts that are ready for them. So if I go through this whole entire credentialing process, I do all this training, I do all this competency test, and then all of a sudden I look in the app and there's no assignments for me, it's going to be 2 or 3 weeks before I delete your app. Mm-hmm. So, it's definitely, we've expanded into 6 or 7 states now. And, every little city that we go to, it's a new micro market with a whole new group of nurses. So, it's predicting well and being confident that you can get facilities, and you're already going ahead of there trying to find out the market. If there's, need for, what are we looking for in this market? Is there more CNA demand versus LPN demand or RN demand? And then recruiting at the same time as signing up clients. So I think that if I had that figured out, we'd be growing our business much faster. But I think that's really, the key to be successful in staffing, is having both supply and demand in a two-side marketplace ready to go.
So did you have any idea when you were starting this business kind of what this road was going to look like, or has this been something that's just been crazy for you?
It's been crazy. When I started it, out of my basement, my little basement apartment in Boston. It's like a 1-bedroom or studio. And then, as we've moved up, it was kind of a 1 or 2 man operation. We brought in a couple other co-founders. And then from there, I think we brought the right people on to help scale the business. And since we really brought the right people on and kind of started filling in spots, the growth that we've seen is something that I probably more dreamed of. But it's happened, and as you grow, you realize you have to kind of fit new roles. I'm not taking on 10 different roles I was when we were starting off in the basement. We've progressed, and I've got to hire people that were more experienced than myself, that were more focused, that had more experience in that particular role. And now, we're at a point where, I'm actually focusing back in on a clinical side, which is, actually kind of my thing, which is great. But before, it's, you were taking on so many roles that you almost didn't have time. You always had to jump in what was the most important right now. Mm-hmm. But now we're at the point right now where we can really focus in on clinical quality, clinical education, different types of engagements, platforms, just particularly for nurses. So I think, did I expect to be where I am right now? Yes, because I set myself with very, very high expectations. But has it changed? Everything I've done changed, and I had to evolve with all the changes. Absolutely. Yeah.
So you started out, was it you and one other person, or was this all just you at one point?
Yeah, it was the director of IT from the hospital I was working at, the long-term acute care hospital, which is kind of in between acute and long-term care. It was me and him. We were bootstrapping for a good year, making pennies, living off of ramen noodles. And I think we brought on 2 other co-founders One really, really amazing at sales. The other one was really came from a technology side, and he's kind of brought up big businesses. You kind of need that, experienced business individual that can kind of come in, raise some funds to grow the business, and also has the experience of growing big teams really to be successful. Because, everyone thinks, well, not everyone thinks, but a lot of people think that, you can start a business and all of a sudden you'll kind of control it, or at least you'll have power and you really know what's going on. But if you haven't done it before, and you try to kind of say, like, I'm going to be the CEO and I'm going to take control of this business and grow it to $100 million, I think the chances of that happening are very, very, very slim if you try to do it on your own. But if you bring some other resources in that have already done it before, you have a much higher rate of success.
Yeah, and that's kind of a hard thing too, is to know when the right moment is to bring people in, and bringing in the right people, because a lot of times, especially when you first start out and you're sharing kind of the expenses of a business, you just want a warm body. But as the business starts to grow, you realize that your partner really needs to be strategic. So having an IT guy to pair up with you was a great idea. The sales guy probably was an awesome idea.
Yeah.
Because it seems like, I'll just go tell everybody about it. It just doesn't work that way. I mean, did you struggle to get your first clients?
I think when we were working in home care, I think we were. It's a very competitive landscape, and you lose clients too because they pass away. When we switched over to staffing, I think that we were in the right area, that there were some local facilities around us that were kind of desperate. Not saying they were bad facilities. They were great. I was one of the nurses that was working all of the first shifts. They were great. It's just they're so small. They're kind of mom and pop type, nursing facilities. And they saw this and they said, oh, my staffing partner, they'll fill a shift in 2 or 3 weeks. And, when we was kind of make it until you fake it until you make it when we started off. And, we were saying, yeah, we'll fill your shift today or tomorrow. And that was obviously me jumping in there and filling their shift. But, that's the other part of the supply. It wasn't there yet, but we still sold it. We met the supply because I was running it on my own. And then we started building the supply. And then, I had to do that a couple of different times, jumping into different facilities and kind of be very, very involved when we started. I think I might have worked 1,000 hours, in 6 months, which is you're trying to do the business and you're trying to be the product of the business. So a lot of sleepless nights and covering call outs and things like that. But yeah, the first couple of clients, we found the areas that need us the most. And sometimes it requires some travel, but it's definitely a market that there's some need. There's definitely competition there, but if you can provide that unique advantage, you should be able to get going if you have the right team to support you.
Yeah, and that's definitely a unique advantage in an on-demand system, and I can imagine nurses would like that too. Like I think I would like that if I was still doing nursing shifts. Like, I don't have anything to do this afternoon. Maybe I'll pick up like $500 or whatever it is.
Exactly. Yeah.
Shift.
Yeah. Our range of nurses, we do CNAs, LPNs, and RNs. So there's a wide spectrum. And some, the RNs, they're in graduate school. They're getting their nurse practitioner. They just had a baby and they can't commit themselves to, working a full-time 40 hours, which is the schedule of a staff nurse is just incredibly inconvenient. So, they come in at 7 a.m, but, your children have to be on the bus at 8 o'clock. So with us, it's, your days off, you're getting able to pick and you're able to kind of fluctuate between which days and which times you want to work. So it's very convenient for a lot of different, we call them IntelyPros.
Yeah, I mean that's huge, and I would have loved that.
Yeah.
So I didn't have you guys back when I was doing my nurse practitioner or pregnant and that kind of stuff.
Yep.
Yeah. So how is it? Are there other companies like you out there, or are you pretty much standalone?
Yeah, there's definitely competition. Other companies have heard of our success. We were probably, I'd say, one of the first ones that I know of to kind of do the on-demand nursing and in facilities and hospitals. Of course, there's always been big, large staffing companies. There's thousands of regular traditional staffing companies out there. But to actually build your own app, to actually, tackle this, we were one of the first. Now we see about 10 competitors out there, and other bigger staffing firms that are either buying out competitors or they're trying to invest in technology themselves to build. But we have a good, strong market presence in a lot of the areas that we're in. But it's definitely going to be more of a challenge going into other markets where people are, have already approached these facilities. They're already having a relationship, and well, I already use that app. That's what the facilities are going to say. Well, I already have an app provider. You still have to sell what are our benefits, what are our core principles, and how we're going to still serve you more than anybody else can serve you.
So in terms of starting up a staffing agency, did you go into this knowing that you needed, I don't know, like 50,000 or 100,000 or whatever it is as startup cost? And how did you fund that? Did you have people help you, or how did you sponsor that?
Yeah, no, we went in with no money, kind of using, we had some savings and whatnot, which we eventually
credit cards.
Yeah, a lot of credit cards, which thankfully I tracked my expenses. So when we raised some capital, I got to be reimbursed for some of it. I didn't track all of it. But I think when we started bringing additional folks that that had a existing presence in the business world and the finance world, we had to very quickly go out there and get factoring, which is payroll factoring. That was kind of it's a necessity to cover your payroll. If you have 200 nurses for you working 20 hours a week, it's waiting for your facilities to pay you back. Sometimes it's 90 days before facility pays you back, so you still have to cover that money. So that's kind of initially credit cards, and all of a sudden credit cards didn't work enough. So it's going out there and kind of selling back to factoring payroll providers, companies that can lend you 80% of what you're looking for. And then as you grow, you're always capped out by some lenders. So it's jumping to the next company that can support your growth, can support your payroll. And then from there, of course, it's, going on to the angel investors. And then, with us, it went on to going to venture capital, due to, a lot of the technology advances that we're having and are wanting to grow really quickly, because, there's a lot of, other technology investors and platforms and entrepreneurs out there that are always looking for the best next opportunity. Mm-hmm. So if we don't grow fast enough, then somebody else might take the business as well. So
right. Now, are your nurses, are they 1099 employees, or do you have to pay them as part-time employees?
Yeah. When we first started off, when we were very, very young, we started with a 1099 and quickly transitioned to employees. There's definitely a debate amongst other platforms of on-demand two-sided economy platforms that there might be an argument for doing 1099s, but in the healthcare world, when you have a manager, when you have training, you'll eventually get shut down for running a 1099 operation, even though there's others that do it. It's just there's so many regulations in healthcare, and there's so much policy and procedures that you have to enforce nurses to follow, that those classifications of what a 1099 versus an employee is, I don't see it being a possibility, and you'll eventually not last in regards to getting some type of large lawsuit on your company. So right. we transitioned probably about 6 months after we started and realized that it was too much of a risk, so we switched over to employee based. Now we're we've added healthcare benefits and other type of features that our part-time employees can have, which is great. And it's definitely something that in the future that we're working our way up to, we can offer 401ks and things like that. So that's definitely in the plans.
Oh wow, for part-time employees.
That's the plan.
That is incredible. So. I want to join. So wow, that's really incredible. So now I have a lot of nurses in the Facebook group that are interested in starting staffing agencies, and my personal kind of bias has always been like, oh God, that's a really tough field to start in, because obviously we all have a bunch of nursing friends and we feel like we could place some people, but when it comes down to getting contracts with hospitals and then really navigating those schedules and the whole shebang, what is kind of your advice to people that are thinking about starting staffing agencies and kind of avoid its mistakes that you would try and avoid in retrospect?
Yeah, I would not do it on my own.
Yeah, that's a good one.
Because it's when you're starting off, it's a 24-hour business, particularly if you're in the per diem world. You're running a 24-hour call center. So, you would need partners to do it. I think there is exceptions. There's most staffing agencies, nurse staffing agencies out there actually travel staffing. When you go to the big conferences, 95% of the big companies and the companies out there that healthcare staff are travel nurse companies. And I think that's a little bit less demanding because you're booking, a 13-week or 12-week contract with a facility that, there's a lot of different staffing agencies that are also competing for the same contract, but it's not like it's hidden and you really have to go out there and sign an exclusive deal. If you're familiar with the hospital world and you have connections and you already are working or know of facilities that use travelers, you could go there and sign, a contract if you could fill their shift. So I would say that for, somebody small that maybe a 1 or 2 person operations that wasn't interested in building, lots of complicated technology to try to manage the per diem world, that would be probably the way I would go. It's a little bit more steady as far as you have a 13-week contract or 12-week contract. You have all that revenue coming in and you're working on the next spot. So, and even when I'm at the conferences for staffing, a lot of the per diem staffing agencies, they still talk about how they don't do anything less than 4 weeks. So, what we're doing is the shift by shift basis to try to take that on as an individual or somebody without, funding to try building technology. It would be, you'd probably die young. That's what I'm thinking, and hopefully I don't. But yeah, I would say look towards the travel to start. Look for the 12 or 13, 15-week contracts. Look for the facilities that have a need. There's other avenues out there that we don't work with. It's outpatient facilities. Some of those areas, surgical centers and things like that, that will still take the longer contracts, but they're being less aggressively pursued by other staffing companies.
Why is that? Why wouldn't you want to be in that area?
I think everyone has their niche, and I think the biggest niche is the travel hospital. I just think that there's less agencies that are concentrating on an area. I don't think that it's not a good area to go. Would we go to say an assisted living versus a larger long-term acute care hospital, let's just say, we know that it would take longer to go to the long-term acute care hospital to sign the deal, but we'll have a lot more spots to fill versus the assisted living, which, has a couple of CNA shifts. So I think it's the same way with the outpatient centers. It's a smaller organization or smaller client, so there's definitely less shifts to fill and less revenue to produce. But people can do it, and it's just how do you scale up your sales and marketing to actually, hit that particular niche and do it in an economical way. Mm-hmm. So we've decided to stay into the post-acute space. That's kind of where we want to live, just because there's, we could master kind of our niche versus trying to just spread ourselves out with everything. We're not going near physical therapist or allied health right now. We're just sticking to nurses, and we're sticking to post-acute. We're going to become really good at what we do, perfect it, and then maybe later on when we're a large company, we can start talking about going to other avenues.
Right. So does post-acute, does that include rehab facilities?
Yep.
Okay.
Yeah, so there's, even though they're a smaller amount, we actually there's actually some detox facilities as well, that are in our kind of our groups of facilities that we work at. But there's assisted livings, there's nursing homes, there's rehabs, there's LTACs, there's psych hospitals, just not the major acute care emergency department type hospitals that we're working with.
Okay, and you do training for your staff as well, right?
Yeah, it's all digital.
Okay. How did you develop that?
We made it ourselves.
Oh my gosh.
Yeah, so when we started, it was more of sign a document and go for it. But we actually have our Joint Commission accreditation survey tomorrow, which is exciting.
Oh, wow. And you're doing this interview today.
We're doing it today. So we've, with Joint Commission, we've added a lot of different competency tests, a lot of skills checklists. But, about a year into it, I started dabbling down making 2D animations. I use contractors through Upwork, which is a platform where you can hire independent graphic artists and 3D animators and even developers. So I've made scripts and I've made kind of funny animations that are interactive that people can watch in their app. Mostly I think because there's not much good content or interactive nursing education out there right now. Even some of the bigger players that sell to hospitals, I just don't think it's that fun to do. I think it's kind of long drawn out and you're kind of listening to one person talk. The graphics aren't really that good. So I think it's definitely an area where more nurses should concentrate on actually kind of growth hacking that area. So I've done it with our own nurses and had, a couple of thousand nurses take on our videos and working on getting some CEUs for that. But yeah, it's definitely it's not easy to do yourself, but if you get the right resources to do it, there's definitely room to grow in that area as well.
Right. So how did you get the Joint Commission to come in? Is that something that you pay them and they come in and take a look at your program?
Yeah. They accredit staffing agencies, which is, what we are, even though some people say we're a technology company. We're a healthcare staffing firm. And they, it's kind of a lot of staffing companies need to get their accreditation very soon because they start working with some of the major hospitals. And sometimes if you're going to be a primary supplier of a hospital and you're doing their per diem, that would be a requirement. There's a little bit less requirements for some of the smaller facilities, and we actually haven't been asked for it by a facility yet, but we're getting it, just to make sure that we're at the highest level we can. And there are some states that we want to enter that also say that you have to get the accreditation within 2 years. So that's definitely one of the reasons where we're going. But looking at some of their policies, practices, and operational sense of what the Joint Commission required, it's great to kind of see what others are doing. We made our business without knowing anything about staffing. None of us knew anything about staffing. We kind of just learned as we went.
Irony.
Yeah. I mean, honestly, we don't have anybody that we've hired that actually has come from staffing either. It's kind of all outside innovators. Of course, we've, worked with some consultants and kind of got some opinions on different, what to do and what not to do. But I think it's just kind of a trial and error thing. And I think the only real thing that we've really now are doing, of course, is with Joint Commission coming in, there's definitely standards and regulations that is kind of industry practices, which, you wouldn't know until you actually start going down that road. So now we have all these skills checklists and different type of features that we can classify our nurses and different type of quality and retraining, which we're already working on, but we just got a kind of a leg up as far as classifying what issues are bucketed into which group.
Yeah, that's incredible. So it's just, how long has this been? How long has this whole thing taken you?
Yeah, I look at my LinkedIn profile. It says 4.5 years. But I think that was me kind of hanging out, kind of dreaming about it for about 6 months or a year. So it's a little bit over 3 years now that we've been really staffing nurses into facilities, and it's been great. It's been growing great.
Yeah, I feel like I can really relate to that. Let me think about it for 6 months and really just kind of map it out and dream about it. And then one day you take a step and it's like,
yep.
Yeah.
It changes your life.
Right. It sure does. And it's a great journey. So,
yeah.
Well, tell us where nurses can find you, facilities can find you. How can we get more information?
Sure. Our website is where to go. So it's IntelyCare.com, IntelyCare.com. I think we're on all the social media platforms, Twitter, LinkedIn, and Facebook. And facilities can always give us a call. We have phones. We're not the original Uber approach that doesn't answer our phones. We have full staffed on that criteria.
Which states are you in?
Yeah, so let me kind of work around the map here. So Massachusetts, New Hampshire, Rhode Island, Pennsylvania, Ohio, Illinois, Florida. We're moving into Maine, and New Jersey. We're moving into as well. So we're really concentrating out the East Coast, and we're going into the Midwest now. And Florida is kind of one of those big markets that everyone's interested in because of the amount of facilities and nursing homes out there and hospitals. So those states right now, we'll be in more soon.
All right. Well, I'm in Pennsylvania, New Jersey, so I will spread the word to the nurses I know.
Great. Wonderful.
All right, Chris, any final words?
I would say for, final words for entrepreneurs out there, don't try doing it yourself. Get a very smart team. Hire somebody that's smarter than you, because if not, you're only setting yourself up for not succeeding as much.
Right, and a very expensive road to
Exactly.
follow.
Yep, absolutely.
All right, Chris. Well, thank you so much for this.
Thank you very much for having me, Katie.
All right.